Okay, so we continue on dehydration. So we are saying dehydration is when one loses um, critical electrolytes. Okay, and what do you do in such a case? You actually make oral dehydration solution. And how do you do it? You can get, if you don't have the one that is bought in the shops, you can have 6 level teaspoons of sugar and half level teaspoon of salt, and you add. You mix them and you pour 1 liter of clean water into a clean container, and that's it. Stir well until everything is dissolved, and that would be your ORS that is made at home. Now, the important tips for you to know that you have made the correct ORS, it should taste like tears, not too salty, not too sweet. That should be used within 24 hours, then throw away. Give small sips frequently. If it's in a baby, continue breastfeeding, feeding. If it's in an adult, they can take water and so forth. Okay? So that's it. But of course, it is important to have the one that is already prepared. Okay. The next condition that would require us to provide first aid is when an individual is experiencing heat exhaustion. Now, heat exhaustion is it would happen when the body overheats and loses too much water and salt, also or electrolytes, probably usually after being in a hot weather or doing hard physical work. And too much exposure, of course, to the sun may cause heat exhaustion. And how do we then know? There will be heavy sweating, of course, weakness or tiredness, dizziness, headache, nausea, vomiting are some of the things that could be noticed. And what do you do? Number one, move the patient to a cool place. Lay them down. If possible, loosen their clothing, elevate the feet, give plenty fluids as they tolerate. Apply cool compresses to just cool the body. If possible, spray water, sprinkle water on them. Um, was it in Brazil? I was seeing people are watching football. It was extremely hot. Then what do? Fire brigade would come with their big vehicles. They are spraying water on the soccer fans just to cool them. That is heat exhaustion. Okay. Then the critical one is the issue of burns themselves. These are very serious. It's a very serious situation. So a burn is a break in the continuity of the skin and the underlying structures. So that is a burn. And this is usually caused by a thermal source or a fire, flames, hot water, etc. So we have different types. We have actually before even come to dry burns, cows, electrical burn. But one thing that we should understand is that burns could be classified as first degree, second degree, third degree. First degree, these ones are just on the epidermis or the first layer of the skin. Then they are very painful because we have a lot of nerve endings in the epidermis. We have second degree burns, which may present with blisters and swelling. Third degree, these are deep damage to the skin. So, as a first aider, you are not giving anything to this patient, but first thing, of course, obviously, from where we are coming from, you need to remove the patient from the source of heat. Okay, cool the burn under cool running water for 20 minutes or less, especially at first degree burns. They actually stop burning if you submerge the affected part under water. The moment you move it out, there's so much pain. So remove tight items, the rings, etc. Do not apply oil. We have seen people applying oil, applying toothpaste, other creams, others even apply butter. That should not be allowed. Okay, that should not be allowed. Treatment, of course, we have already said we may rinse the injured part with cold water for at least 10 to 20 minutes. Gently remove any jewelry. Cover the area with sterile dressing or clean non-fluffy material. Okay, and then one thing that we also need to understand that the moment a patient is bent, if the bends are so extensive, they are also susceptible to infections. Remember, under immunology, the first defense, the non cell cell mediated immunity, it has to do with the skin, physical barriers. So ensure that you prevent any sort of infection to actually have access to these veins. There's no skin, so anything may just result into infection. So the patient should be reassured, lay them on a flat surface as you arrange for transport. So when you receive the notes, you will discover that there are different types of, or in terms of management, in terms of first aid, according to the type of a burn, whether it's first degree, second, or third. The other condition that may warrant us to offer first aid is electrical shock. Electrical shock, and this is when an individual is electrocuted. Okay, electricity passes through your body. And usually this is when this contact is sustained. Okay. It is when electric current passes through the body. And this one again is very common when we are touching exposed or damaged electrical wires. You are not an electrician, you are busy trying to connect your gadgets, your sockets with the empty, naked or empty, or hands that are not covered, rather, that's a better term. Okay, so that could be an electric shock. There will be muscle spasms at time. Apart from that one, loss of consciousness will be noticed. Regular or stopped heartbeat could be one of the thing that would be noticed. Signs, I think this we already said. How then can we help out? Cut off the power supply and remove the victim. And you, when you are removing the victim from the source of electricity, do not use a wet item. We have seen a situation when someone is electrocuted with the power sources that supply homes. Individuals will get fresh branches, trees which are not even dry, trying to remove such an individual. It becomes a conductor and you are also electrocuted. So ensure that when you are doing this, do not use any wet item. When that is done, we come to another condition, poisoning. Now, poisoning is even more common today than before. It's like it's one thing that individuals will tend to, once they are frustrated, life is not making any sense, they want to take off their life. So it happens when a harmful substance enter our bodies by swallowing, breathing in, touching skin, or injection. But what is very common nowadays is the one when people are able to drink in these poisonous substances. That's someone who was asking, is there anything has expired, like this poison is expired, it can't work? Anyway, that's just a question. So that's poisoning. Introducing happens when a harmful substance enters the body by swallowing, breathing in, touching the skin, or by injection. And what usually do we do? The dose, check the danger. Okay, give large quantities of cold water to dilute down the poison. But in certain poisons, I think don't even give anything. You may end up worsening the condition. Then remove the person from poisonous source. Do not make the person vomit. Okay. Then do not give food or drink unless told by a healthcare provider. Then besides this, if there is any question, oh, if there are any questions, please should be able to ask questions. Any questions so far? So any questions? Any questions? If there's one with a question. Okay, if there are no questions, we can continue. Am I still audible enough? Are you
Yes,
able to
sir.
get me?
Yes, sir.
Okay. Is the slide moving?
Moving.
Okay. So on poisoning the dose, we were saying check for foreign matter in the mouth of the patient and remove such a substance if you are able to see it. But of course, what is very, very important when we are dealing with poisoning, we okay, so I was saying maybe just to add to what we are able to see from here. I think earlier on had said do not make the person vomit. Okay. The reason why we are trying to avoid that it is because you do not know the substance that they have swallowed, and if they are made to vomit, the the vomiters may just burn the lining of the GIT as the vomiters is coming out. Then, apart from that one, it may cause choking, and you may end up pushing the poison into the lungs. So do not make them vomit. We have seen traditionally someone will even be suggesting, no, can you pass a finger on their throat? That should be avoided. Do not give food or drink. Now, the reason why we are saying this is because food or drink will increase absorption of the poison, or it may even cause just reactions. So that again should be avoided at all cost. If the poison is on the skin, rinse with clean running water. We know that water will dilute and wash away the poison, and at the end, it may just reduce the chances of burning or damage. So the rinsing can be done between a time span of 15 to 20 minutes. Now, even as you are doing this, it's important to have the container or the source of the poisoning with you so that once you're at the facility or institution, it is easier for you to check the contents of the poison. The other one that we can look at, it's to do with the dog bites. Okay, dog bites, very very common, but of course, a dog bite is just an injury that is caused by a dog's teeth. What then do we need to do? Of course, our aim is to prevent rabies, to reduce the risk of infection, and to get medical aid as soon as possible. There's someone writing on my screen, not knowing who. So the do's that you need to institute: wipe the saliva away from the wound using a clean cloth or handkerchief. But the obvious thing that you need to do immediately is that you need to wash the wound thoroughly with plenty of soap and water. Again, your hand should not be ungloved. We need to have gloves on your hand. Cover the wound with a dry, sterile dressing. Get medical aid as soon as possible. If there's bleeding, you need just to apply pressure so that the wounds are not bleeding. Then don't apply so much like you cover with a bandage all around, because the tight closure that you may apply may trap the germs and other toxins inside and will definitely cause an infection. So all in all, this patient, of course, would need anti-rabies immediately they reach the facility. Then the other obvious thing that we normally experience are insect bites, bees, mites, leeches, wasps. Okay, those are very common. Now, the first aid, just last week, we had one mother who died. The bees came to her home. So, unfortunately, the dose of the toxins resulted in shock and she died, and they actually buried last week. So, and I also need to say that we have different thresholds on how we actually respond to these insect bites. So, in short, what you need to do is that number one, you need to remove the sting if present. That thing that if, for example, a bee will live at the site of biting, you need to find a way of removing it. scrap it off gently with a fingernail or flat object. Why? Because you want to stop more venom from entering the skin. Do not squeeze it. The moment you squeeze, you are now squeezing everything inside. Then, beside that, you can apply a cold compress just to reduce pain, swelling, and itching. Then, I know you may not have calamine lotion. This could be found at the clinic, but it can also be very helpful in terms of the itchiness. It has an antihistamine component which can even reduce on the swelling. So when you are doing this, it is important for you to check for allergic reactions. Allergic reactions, very important. Check for them, such as difficulty in breathing, the face has swelling, tongue, dizziness, or fainting. The other time, I had a wasp sting on my nose. I felt as if my whole face had collapsed. So such should be noticed. And also monitor, if possible, drink a lot of water. As you are drinking a lot of water, the excretion that is happening when you go to the toilet to be flushing the body. So that is also very helpful. Clean the area, apply onion juice if you have it. If not, just leave it. Then we have foreign bodies in the ear. Now, foreign bodies usually sometimes they are insects, acid, or whatever. What I've learned over time, yes, they can be removed at the facility, or at times, if it is an insect, you can just put a little of oil, which will make the insect, if you are still feeling it is inside, which will make the insect collected, and then you bend the other end and you would see these things come out. But if not possible, washing, if the foreign body has gone in the eyes, you can wash off the dust or the foreign substance. If not, rush such a one to a facility or hospital. In the nose, and this is one thing that I learned over time. What I've noticed, like children, they would want to put beans, seeds, especially beans. So when they put that seed in the nose, what it does is that am I audible still? Are you able to get me?
Yes, sir.
Okay. Let me just reshare it. So what it does is that when you put a bean seed in the nose, because of the moisture content, because of the content of the nose itself, the the bean seed will swell. Okay, it swells, and when it swells, it becomes practically impossible for it to come out. So what I learned over time how to deal with such, you get a needle, a bigger needle, the green one, then you make a curve so that it looks like a hook. Okay, it looks like a hook at the end. And following the walls of the nose, try to scrap it like you're hooking that bean seed. It comes out easily. It comes out very easily. Sometimes what I've noticed, though it works, yes, people would be given anything that will irritate the nose, and then they sneeze with that force, and definitely it comes out also. Sniffed tobacco, have you seen it being used? They would put it in the nose, and then this patient reacts towards that, and as he is blowing the nose, also that foreign body comes out. Then what I've also noticed sometimes, if it is on the throat, the bone or what, they would give a piece of banana, not even chewing it. And then, since the banana is a bit harder, the banana will ensure that that substance is pushed downwards, and that becomes easier. Okay. So all in all, I think from where we're starting from, if you are not sure of what you are doing, do not just start and do not just do it. I think it ends there. It becomes so critical, because at the end of the day we end up injuring the patient. Then what are the emergency methods of moving casualties or clients? We can use one-man human crunch if they are conscious and they're able to walk and they'll just need some assistance, so someone can walk with them. Pick a back, conscious, lightweight, they can be put on the back. Cradle, lightweight, for example, a child, they can be lifted as such. So these are some of the methods that could be used for moving casualties. Yeah, the method, I think, the other ones are being shown in the picture. We have A, B, C, D, and F. Someone is carried off. This is an unconscious patient. Okay, two-hand sit, that could be done. Three-handed sit, that can also be done as you are moving. Four-handed sit, you make a seat for them where they sit and easily you are able to move them. For and after method, someone is in front, the other one is behind. That can also be done. Now, points to remember: medical emergencies can happen anytime and anywhere. And I should also say that it's criminal for you to run away from an emergency. For example, where you are found to be in an area where an emergency occurs and you run away. If, for example, CCTV is reviewed and they discover, oh, amongst the people that were surrounding this patient, we had such and such a student. And if the council knows, even the health authorities know, it would be fit for you to be blacklisted. Why? Because that becomes negligence. You are running away from an opportunity to provide care. And at your level, you have been subjected to certain procedures in the skills lab. Yes, you can maneuver around, but running away becomes disastrous and you are held liable. So you need to act quickly, calmly, and correctly. And that's the end of the presentation. Any question before we end?